sentences. We count down the 10 most infectious diseases. Number 10. Rabies. Rabies is fatal if not treated immediately. You contract rabies typically after being bitten by an animal or even another human that has it. The thing is, you should seek treatment anytime you are bitten because the chance of surviving rabies if treatment begins after symptoms pop up is about 8%. Those aren't very good odds. Ever heard of foaming at the mouth? That's rabies. The disease kills about 55,000 people every year, and people who contract the disease must live with vicious side effects like acute pain, violent movements, and mania. Number 9. Smallpox. There's a reason why we work so hard to rid the world of smallpox. Once you have smallpox, your body, including your mouth and throat, become littered with pussing, fluid-filled bumps. The disease has killed 300 million since 1800s alone, but it's been around since about 10,000 BC. Just pray that you don't get hemorrhagic smallpox, which causes bleeding to occur under your skin, which sours your body, earning it the nickname blackpox. Number 8. Tuberculosis. Be careful when you see someone sneeze, because that's how tuberculosis spreads. It's no laughing matter either, as over 1/3 of the population is infected with tuberculosis. However, this is likely just a latent form, and the symptoms will never arrive. If they do, however, which is about a 1 in 10 probability, you're in for a rough ride. Coming in at a 50% mortality rate and killing 1.5 million people a year, tuberculosis' main target is usually the lung, but will move around attacking other organs, including a male's testicles. If you have a weak heart, mute this for a second. Tuberculosis can, at times, erode the pulmonary artery, causing your lungs to fill with blood. Number 7. Influenza. Influenza, more commonly referred to as the flu, is seen as less of a threat today simply because we have the means to treat it. But that wasn't always the case. In today's day and age, people will only get the flu a couple times and get over it pretty quickly with some over-the-counter drugs or an annual flu shot. However, in 1918, things were a little different. The Spanish flu killed 100 million people, including many young and healthy people. The reason for this was because the flu could turn an immune system against the patient's body, meaning the healthier you were, the more deadly the virus became. These days, strains of the flu are appearing to grow stronger, so let's hope we don't see anything like the Spanish flu anytime soon. Number 6. Anthrax. Yes, anthrax makes this list. Why? It's a bacterial infection that's super lethal. Before anthrax became a household name after the attack on September 11, 2001, it was still just as lethal and wreaked havoc all over the world. Anthrax is insanely fatal. Even one of the ingredients is aptly named lethal toxin. Anthrax is most dangerous through inhalation, ingestion, or through broken skin. Diarrhea is usually the first symptom, with death following within a few days to 2 weeks. Anthrax is one of history's worst villains. An island in Scotland was marked uninhabitable for 50 years after anthrax contaminated the area. Burning is one of the only ways to kill anthrax. All around, it's a vicious beast. Number 5. Cholera. Cholera is a terrifying infectious disease that has struck fear in the heart of man all throughout history. Cholera spreads through contaminated food and water, allowing the disease to spread like fire. It has killed millions, and to this day kills 120,000 people or more each year. Cholera can cause patients to produce 5 gallons of diarrhea a day. Today, if you can find treatment, you only have about a 1% chance of dying. However, there are strains that can kill within 2 hours.